Hello, Pierre. Welcome to the Emil podcast. Today, I'm actually really excited to touch base with you today with regards to the type of work that you do around men's health and coaching and the type of positive elements that often a lot of people miss when it comes to focusing on how men do life really these days. And now more than ever, I think there's becoming more of a focus on the nuances in approaching men particularly, rather than employing sort of a blanket approach in therapy. So it's kind of, there's a lot of interest there for me personally, and as a father of two boys, and also growing up as in a sibship of four boys. So it's an interesting process. I'd love to actually, I'll give you a chance to introduce yourself, Pierre, and we can go from there.
Thank you, Emil. My name is Pierre Azzam. I am a psychiatrist by background. So I've worked in the arena of mental health for about the last 2 decades. And in the last 5 years, I've turned my focus and attention to working with men at times of, initially at times of big life transition that started with an interest in early fatherhood, and has since moved to working with men at all stages of life. And so I started Braver Man, which is in part a forum for individual one-on-one coaching for men, and also a platform for raising awareness to men's mental health, building knowledge and advocacy. And it's largely been through opening conversation about my own experience around mental health, but also inviting other men to do the same.
Yeah, and that's that. For anyone who hasn't been oriented to Pierre's Braver Man platform, he is on Instagram. That's how I found him. Braver.man is the handle.
That's
Is
right.
that correct?
That's
All right,
correct.
wonderful. And you mentioned to give him a follow because it's a really great content there. There's a lot of great posts and stories and videos that you share around, as well as your own experiences and small reels with 60-second or 30-second tidbits. It's a great way of just having that daily dose of mental health awareness. So yeah, well worth a follow.
Thank you, Emil.
Pierre, you mentioned your own experiences and coming into this space, uh, coming from a psychiatric background to a coaching background. You were working as a psychiatrist for 15 years before starting coaching. Is that fair to say?
That's right. Yeah, that is fair to
Yeah.
say. Yeah.
Tell
So
me,
that
tell me a
transition
little
was,
bit about that evolution. Yeah.
yeah, that transition was unexpected. It was not premeditated, but in many ways, um, I started out working as a psychiatrist at the interface of other medical disciplines. So I was largely working with people in the palliative care realm. So
Mm,
people with chronic and severe and life-limiting illness who might be facing depression or anxiety or confusional states in the general hospital. A very small sliver of my work involved working with pregnant moms.
mm,
And that led to some interest in navigating and helping to navigate early parenthood.
okay.
And initially, that was working with other psychiatric colleagues who were treating moms, helping moms to withdraw safely from substances, helping them to transition into the early postnatal period. But one of the things that became quite evident fairly quickly was the lack of available services for dads, for
Mm,
fathers. And that interest started to grow, I would say, about 5 or so years ago, when I became introduced to other people who were engaging in work around helping new fathers and helping men. And that led to some interest in modalities of help that might really be more inviting for men, and a fair bit of research around the action-oriented focus of coaching. I became interested in coaching in part to complement my work, and was surprised to find it to be really a wonderful forum for helping men to determine the important aspects of their life, the values that they really wanted to build, and sort of grow into in early fatherhood. And I started to work closely with men at this time of change, and that's expanded into trying to help men to appreciate the experiences around mental health and mental illness, and also to really experience and appreciate the challenges that are associated with day-to-day life, but also major life transitions, and in essence thriving within their lives as husbands, as fathers, as partners, as leaders. And so that's been really the push toward building braver men and helping men at these really pivotal moments in life.
So braver man, how would you define a man who is braver?
Yeah. Well, I think it's an interesting, it was when I was thinking about helping men in a way that felt universal, one of the things that I thought was just really building courage and building bravery, helping men to take on challenging circumstances, even when they know that they're challenging, even when they know that there might be some discomfort. I think bravery is really just being present and aware and full of heart, and being willing to take challenging or risky moves for the sake of what might feel most important to him.
So kind of like a values-based approach where you're, no matter how you feel about a particular thing, doing nothing is worse than doing something, even though the something that you're doing is going to create a whole ricochet of feelings that often people, men in particular, may not be comfortable with expressing or asserting. How do you balance the sense of ambivalence about bearing one's own heart and getting in touch with what's happening in a guy's body, and kind of reframing that to say, well, this is bearing that is actually a big indicator of becoming a braver person, and being able to integrate that with not becoming, to use a personality term, more and more agreeable, so to speak, and letting other people walk all over you because you're experiencing a lot of emotion or the rest of it. I don't know. I'm just thinking out loud here, and saying, well, no, actually, bearing yourself is a braver option rather than the rest of it.
Yeah, in part for me, that has felt like it's had to be done through modeling. In other words, I felt compelled to myself be more open about the parts of me that I might normally shut down or close off, and also to allow myself the discomfort of that. So for me, the parts of me that have felt less, perhaps less perfect, more unsavory, the parts of me that have suffered from depression and feeling uncertain about myself and feeling shame. There are parts that I've hidden for long stretches of time, decades, my whole life. And in many ways, I take the approach of experiencing and perhaps showcasing some of the challenges, but also some of the beauty of being a little more vulnerable.
Mm.
And and how perhaps that might have seemed scary or um, weak in my own eyes,
Mm.
uh, but how I've perhaps used that to cultivate strength to move forward. And so I think many men fear, and I'm included among them, this sense of being so vulnerable as to be walked on or to feel like I've melted into a puddle. But
Mm.
in fact, the the alternative is just as or more challenging, to be sort of um, so fortified behind a wall, um, behind a shield, um, that I'm not actually capable of connecting with another human being. And so I think part of my focus has been on helping men to realize that being aware to their own vulnerabilities allows for um, a a responsive and honest reaction to them, rather than, you know, parts of my vulnerability showing up in anger or in fear or in undermining or in hurting someone else. In part, it's I can be vulnerable when it's safe to be vulnerable. And how do I use that vulnerability to inform and to move me forward in whatever values feel most important to me? So for me, that has been in connecting. And
Mm.
I would say, um, those of you who've uh, seen posts that I've put out have probably seen a
Mm.
common theme, that I build walls around myself that keep me looking perhaps untouchable, looking um, like I've got everything in order.
Mm.
Um, but what I really most value is connection. And I recognize me putting up fronts of having everything in order when things are not in order actually keeps me from being able to do that. And so it's a sort of a paradox, because part of me thinks if I just showcase that I have it all figured out for myself, I don't need anyone else to fix my problems, um,
Mm.
they'll see me as more worthy. But the reality is, they see me as less relatable, less touchable, less approachable. And so I think
Okay.
that I showcase that, or at least I aspire to showcase that, a little more openly, so as to invite the same sort of conversation with other men who may be facing something very similar. Maybe it's something slightly different. We all face,
Mm.
I think, different vulnerabilities. Um, but but I think I try to, in this case, to model and then invite other men to be brave through vulnerability.
Vulnerability.
Yeah.
It's been a key word. I think from the work of Brene Brown, the social scientist. Yeah, and she talked about vulnerability quite a lot. And one of the things that stuck out to me is in a conversation that I think was one of her TED Talks. She mentioned that a man came up to her and uh, he's like, well, you rave all about vulnerability, but every time I show myself to be vulnerable, the women in my life respect me a lot less. So how the hell do I balance this sense of vulnerability and becoming strong, because the people around me need me to be strong and be a leader and be the rest of that. So there's kind of that inner vulnerability as a trademark of masculinity, so to speak.
Yeah.
What are your words on on these experiences?
Yeah. Well, I think the sense of invulnerability has long been viewed as inherently a masculine trait. And I think that there's also a sense that perhaps vulnerability and strength feel dichotomous, as though they're mutually exclusive.
Mm.
And again, to be um, inclusive of both requires sort of seeing the grays,
Mm-hmm.
allowing yourself the capacity to maintain the strength so as not to feel um, weak or incapable,
Mm-hmm.
maintaining the agency that you might need in the moment, while also the vulnerability to carry forward connection. And so I think there is a middle ground. I think that part of the challenge for in the study of masculinities, and this has been a big area of research in the realm of psychology and sociology and mental health at large, has been that there are very rigid rules around what masculinity entails, at least socially in the
Mm.
West. And a big part of that is invulnerability, is the sense that I have to have it all figured out. I should be self sufficient.
Mm.
What I need most is to be daring and invulnerable and strong. And I can't ask for help. I can't have a showcase of falling apart.
Mm.
And I think often what that drives is a very binary thought that I can't show any vulnerability whatsoever. I can't be anything but absolutely rock solid all the time, whether
Yep.
that's in my career or in my home. That I've got to put on, even to put on airs to maintain this sense of invulnerability. Well, in many cases, that's not really authentic, and it's not compatible with humanity. We all experience a need for one another and the value in connecting to one another and in receiving
Mm.
help from one another, perhaps not knowing everything. Um, and I think that there is this really strong gray zone between being completely vulnerable and falling into a sort of a pool of emotion and being completely rigid and untouchable and wholly self-sufficient to a point that I can't receive any help, nor will I take
Mm.
it. And I think for very long the rules of masculinity have been that you've got to be wholly invulnerable, that you can't let a little bit of vulnerability in. And I think part of the realization in letting a little bit in is that there's a lot of gray, that you can actually get more from being strong and vulnerable at the same time, that they're not necessarily mutually exclusive, that they're not binary. In fact, being vulnerable allows you to build the strength in order to encourage other people, in order to encourage yourself, in order to have a very open view of the resources that you might need from someone else in order to really maximize the quality of your engagement in your life, no matter how you show up. And it allows you to take on those resources without feeling this unnecessary sense of guilt or shame. And I think this has been highlighted in many studies of the, the sheer vulnerability that actually comes about from being rigidly invulnerable. Men who ascribe to very rigid rules of traditional masculinity are in fact struggle in many ways um, during moments of transition and personal life change,
Mm.
during moments of hardship, are at greater risk for for depressive and anxiety disorders are at less likelihood to seek help. And so we find that there is some value implicit to being vulnerable, while
Yep.
also upholding a lot of the traditional masculine strengths or traditional masculine values of being strong and being self-sufficient.
So are you a few questions come to mind now.
Yeah, go for it.
Number one is, I'm going to try to place these because they can take us in three different routes.
Yeah.
So, a first one is in popular culture, whether in movies, music, what have you. Have you been able to observe any man who is able to balance the masculine and the also so the invulnerable but also vulnerable and courageous side of their personality? So a person who comes across very strong but is also very open and able to express their emotion, able to touch on these sorts of sides. Is there anybody immediately that comes up, or when you think about it, that comes up and say, well, actually, this guy is what a man we kind of see or aspire to be, like this person, a leader, a strong person, but he's also very in touch with his emotional side. Anyone that comes up for you?
This is a great question. I feel so. I get very invested and involved in television, which is why I probably avoid it as much as I can. But one of the shows that I've come to come to watch of late has been The Witcher, starring Henry Cavill.
Oh,
Uh,
okay, yeah.
yeah, and The Witcher's name is Geralt, the protagonist of the show, is by default very much he's a Witcher in many ways devoid of emotion altogether, and very strong, very stoic, very in many ways just very manly, very masculine, and he takes on the caretaking um, of one of the female leads in the show. She's a princess named
Mm,
Cirilla, and and I think we see a little bit of the inner workings for him of having this, and he sort of ends up becoming like a father figure for this young girl who is essentially in exile, who's lost her family. And we don't see a lot of emotion in this man, at least not to start, because in essence, he's his sheer nature, his sort of mythologic nature, is one of being void of emotion. And yet we
mm,
also see um, this soft capacity for connection and caretaking in the form of what is, for all intents and purposes, fatherhood. And so I think that's the one that comes to mind, but probably only because it's not a great one, but only probably because it's been one that has been, uh, for me, at the fore
yep.
uh, of modern day television. But it does speak to this important point of how do you share both the daring and the courageous elements of killing monsters while also tending to the needs of um, an adolescent, young adult um, princess who has lost her family and
Yeah.
is striving for sort of coherence and love.
Yeah, it's a
Yeah.
good representation, and no one could accuse the Witcher of being uh, less manly for doing
Ah.
something like that. In fact, it
Oh.
will bring out the more attractive parts of the Witcher if he's able to balance killing monsters and caring for those he loves. Yeah,
most certainly.
it's got a very deep evolutionary base over there as well, from an evolutionary psychological point of view, where you're there for the family that you love, that you're committing to, that you're protecting, and at the same time you're able to go out on a hunting trip and bring home the bacon, so to speak.
Yeah, yeah, most certainly.
The first thing that comes up, I don't know, as I was thinking about, for me, and I don't know much about this person apart from what I see. Obviously, unless you know him, you're kind of left making an assumption by
Yeah,
what you see on TV. But Dwayne "The Rock" Johnson,
yeah, he's
he's a guy
great.
who, he comes up like he's pumping weight, he's ripped as all hell, and he's a real go-getter, and yet and yet he bears his heart. He talks about his family life. He talks about, he acts in kids movies. He does, a ton of things that incorporate so many different elements, but you look at him, and he kind of, just by his sheer presence, he invites people to him rather
Yeah,
than away from him, because he's so strong, and kind of stonewalling everyone, or the rest of it. So
yeah,
that's one that
that's a
comes to
great
my
one.
mind.
That's a great one. There are all these images that come to mind of him with like painted fingernails and and makeup all over his face. It doesn't.
Yeah.
In many ways, it sort of adds to his sense of personal approachability, but also a sense of security, or a sort of solid sense of self.
Mm.
Yeah, and I would say in many ways it's those men um, to whom many of us aspire.
Mm. Yeah, I would certainly
Yeah,
see that, where a person can, yeah. And I think psychotherapy is a lot of the processes are around integrating divergent elements of oneself, whether that's
yeah,
an emotional experience that kind of kicks your legs from underneath you, and then balancing that with what's going on, or what's happened in the past, and how that relates to the present, and making sense and integrating these, rather than splitting these off and being driven by the waves of discontent. And it's a tough gig. But when you're able to integrate these, people like who do it really well, such as, in my estimation, The Rock, and perhaps the elements of The Witcher that comes up in terms of all this dragon slayer, so to speak.
yeah,
Is able to come into his own when he's caring for somebody, and in fact that makes him a lot more attractive.
yeah.
So it's a interesting one. I the other question I had, uh, and before I ask this question, do you have any side notes to add to what we've said so far?
No.
No, okay. So the other question I had was, there are some men in particular, that find it physically difficult or damn near impossible to become one with their emotional side. So they may be the person who has a very like an engineering job, or an architect, or somebody who's just doing a very heady job, and they're cut off from the neck down
Yeah.
when it comes to identify. And then uh, they might be struck at some point out of nowhere with a panic attack, or something similar, that they're not quite sure what's actually going on. Do But all intents and purposes, before then, or during life, they're not able to pick up on these things, or they're like, no, I'm fine, I don't get emotional. And they really believe it because they feel it. They don't, or more to the point, they don't feel it. So
Yeah.
what's your sense in those situations? What's happening there?
Oh, yes. I think this is really a common experience, um, and it's rare for invitations to be made to men to share emotion, to be upfront about what's happening from the standpoint of feelings. And in fact, there's been a fair bit of research to describe the lack of awareness to emotion in the form of what's called alexithymia, which is really the
Mm.
incapacity to describe emotional states, whether it's our own emotional states or other people's emotional states. But there's a fair amount of research to suggest that it's so common in men as to be normative. That is, it impacts more men than it doesn't. And it's not to say that uh, we men aren't capable of emotion. Far from it. Um, it does speak to the lack of invitation, though, for us to build awareness to it. We're more than anything, we're encouraged um, to squash it, to stuff it down,
Mm.
to put our heads down and keep moving forward, to not cry, to not show emotion, particularly emotion that feels invulnerable or that feels vulnerable. And so emotions that may be allowed are emotions like anger, and many of the other emotions, joy, surprise, sadness, grief, they're dismissed or they're minimized or they're suppressed. And so I would say after decades of that and just common approaches, common tendencies to suppress, it's hard for guys to be upfront and open about the experience of them. It's hard for me. I mean, and I'm sort of, I suppose, I'm trained to invite people to discuss their emotions, but um, for me, it was very difficult to access them and to define the words that would describe them, to even know what I was feeling. Most of the time, if I were asked, I'm fine, and that's that. And so,
Well,
uh,
I don't know. I don't know.
I don't
Yeah, that's,
exactly. I
I
don't
don't
know.
know. Like, what
Yeah.
are you feeling right now? I don't know.
Yeah.
Yeah, it's the kind
Yeah.
of like
Well,
good, you know.
how could you know? You've never really been invited to answer that question in a way that makes the answer feel safe. I
That's a
mean,
good
most
point.
of the time, if you respond to that answer and you feel highly charged, you're probably going to get at the least some minimization or some positive remark, at the most a tremendous amount of shame. So you learn pretty quickly to say you're fine and move on.
Yeah, most people
Uh,
don't like to identify with that shameful element. That's an ostracizing the tribe element. So it's kind of like, nah, yeah, let's keep it
yeah,
in, hey, right
yeah,
here.
yeah, 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 for sure, for sure. Um, so what happens when emotions come up when you're in your 20s, 30s, 40s, beyond, after decades of holding it in? Well, for starters, most guys are pretty surprised. Where did that come from? I didn't expect to do that. Um, there does have to be this sort of awareness that emotions come as they are, that we place a lot of judgment upon them, but in many ways they're bodily responses. There are brains and bodies' responses um, to a situation at hand. Sometimes they don't make sense, and that's okay. And they're not necessarily designed to make sense. And so I would say one of the ways in which I find myself compelled to help men to identify their emotions or even to identify what's coming up for them is, even if we don't necessarily have the words for the experience, we can put some words to the physiologic, the visceral, the somatic experiences, the bodily experiences that emerge. A man might feel small or hot or closed or tingly or short of breath. Um, and sometimes just staying with an awareness to the bodily experience allows for a building of awareness to the names that you might put to these experiences. And so sometimes that may start with, I feel heavy in my head or in my eyes.
Mm.
Um, or I feel open and I feel really big, um, rhythmic in my chest. The first might equate to a feeling of sadness, the second to a feeling of joy. Um, but most of the time, I start with inviting men to get very clear on their bodily experiences before, I think, before putting the pressure on any guy to name an emotion, because sometimes we don't even have the words for it. Um,
Mm.
yeah.
All right, that's a good point. Yeah. Anything else you'd like to add to that?
No,
No.
I would say
There's a lot that's
that's an important
yeah.
start. Yeah.
I think it's a great start. And do you know much about the physiology of if someone's doing, say, a menial task, say washing the dishes or going for a walk or having an appointment, and just seemingly out of nowhere, a panic attack hits when
Mhm.
there's nothing that happened before, nothing that's happening right then, and they haven't had these bad experiences in inverted commas before, but they
Yeah.
just kind of come up. Do you know what's going on there?
Yeah. Well, in essence, I think well, yes, in essence what's happening is there tends to be a tremendous amount of limbic firing. So firing of parts that are associated with defining the um, the importance of emotion, threat, uh, or emotion based on history. And so, in many ways, it's the emotion or the sensation of threat happens in an otherwise innocuous situation, in a situation in which there is no threat. And in the case in particular of post traumatic stress disorder, where there may be an element of panic or re experiencing, often there is um, activation of limbic networks like the amygdala that are responsible for signaling threat and that lead to an almost immediate, I mean, it's sort of the immediate sensation that we get and we're designed to get in the context of what would normally be an absolutely threatening circumstance. So there are some prototypes that are evolutionarily born into us. Like babies will respond with crying and fear in the context of loud noises or quick movements or the appearance of a threatening stimulus. We might respond quite quickly if we saw something sliding or scurrying along the walls, or we hear a loud noise. In advance of really reasoning through the very fine details of what is causing the threat, or even determining whether the threat is a true one or not, our bodies are equipped to respond. And so it's an evolutionarily adaptive experience. And it's heavily rooted in the limbic system. And essentially this network of more primitive structures associated with emotion, memory, emotional valence, defining the emotion or the importance of a particular emotion based on a stimulus,
Mm.
um, and that are then connected to parts of us that change um, our physiologic markers that cause our heart rate to go up or our blood pressure to go up, that might release hormonal cues of threat, hormonal cues to act, and that essentially guide us into this very strong sympathetic response. And so, in part, it's that activation, but also there's some research.
Sympathetic for our listeners. Sympathetic
Yeah,
doesn't mean sympathy. It's just
yeah,
it's a biological term to just describe the part of the autonomic nervous system that is related to keeping your getting your body ready for action. Is that,
Yeah,
yeah, just to clarify
absolutely.
for our
Sort of the
listeners who
fight
might
or
not know
flight
that?
response.
Yeah, yeah.
Yeah, absolutely. And so it gets us ready to move. And so in essence, um, there are also a lot of feedback networks. And I think much of the research around the mechanisms for treatment involve feedback mechanisms that might tamp down that response. And
Mm.
so that's generally what ends up causing this very immediate reaction. And lots of connections between the sort of the neural networks in the rest of our bodies to allow us to have this very immediate response. From a cognitive standpoint, if we just look at the experience of cognition and sort of put aside neurochemistry or neural networking, here we have this response that feels very much uh, like itself is a threat. And so
Mm.
many people who are in the throes of a panic attack or in the experience of re-experiencing through PTSD will then describe the catastrophization, this feeling of having a heart attack or feeling like I'm dying or feeling like I'm losing my breath. And that only magnifies this cycle of fear. And so it, at least for panic attacks, the response is very much one of this sort of cycling where there's a peak at about 10 minutes, 10 or 15 minutes into it, but often starts with this sort of immediate sense of fear, the bodily response, and then how our brains will code that response as being nihilistic or catastrophic. I'm dying or I'm going crazy. And so that heightens the response, and it's sort of um, this recurrent loop.
Yeah. And it becomes
Yeah.
a sort of moral injury in certain men. So what I mean by that is, I think moral injury comes from the work of, I can't remember what his name is, but he wrote the book Achilles in Vietnam, and he's a psychiatrist who worked with a lot of Vietnam veterans, and he proposed this form of moral injury where a person knows what they're doing is wrong and they're acting still in accordance to that, for our audience who hasn't heard that term. And if a person who is otherwise, well put together in inverted commas, or is able to not feel, and that's their badge of honor, and then this comes up, and then they know it's a panic attack, for some reason, it's like, oh crap, I'm having a panic attack. Then it goes to the root of who they are. Men don't have panic attacks, and it kind of happens it can happen quite quickly, and then that exacerbates. It's like, I'm going to be a fool in front of whoever sees me have a panic attack, and then that makes it even worse, and then it kind of brings it back. It's an interesting experience from a scientific point of view how this happens, but it's a terrifying one when a person's going through it, especially a man who prides themselves on non-feeling.
Yeah, for sure.
Yeah, this is a
For
cool
sure.
way, a cool form of a discussion, because it's like, hey,
Yeah,
yeah, anyone can experience this.
absolutely. And anyone can. I mean, I think it's sort of a recognition too that we're none of us is immune from the experience of depression or anxiety or PTSD. And part of an open dialogue about that is helping men to lessen the stigma that might be associated with having one of these conditions, which has nothing to do with our sense of manliness or our sense of strength, but is so heavily rooted in stigma around showing up as a man. It's not manly. It's never been to be depressed or to have a panic attack or to be crippled by anxiety. It's never been seen as compatible with the most virtuous experiences of masculinity. And that is that is a highly problematic paradigm when you've got all of mankind, all of men, who are at risk to experience any of these conditions, but feel like they can't or they shouldn't, or if they do, they need to hide it. And so I think we're seeing more and more people speaking out, being honest about their experiences with mental illness, being honest with their experiences with even common challenges associated with mental health, to reduce the stigma, to lessen the feeling of shame that might be associated with being somehow emasculated or lessened in status or lessened in capacity by what we're all capable of experiencing. No one of us is immune.
Well, what would you say some of the most common mental health conditions are for men these days? And then how do they compare to historic experiences, if you do have that know-how?
Yeah, well, I think on the whole, for all humans, the most common cluster of mental health conditions is anxiety disorders. And that constitutes panic disorder, generalized anxiety, social anxiety disorder, or also known as social phobia. It used to comprise two other conditions that have since been sort of separated out, but are also quite common in men, and those are obsessive compulsive disorder and PTSD, post-traumatic stress disorder. And I think more and more research is suggesting that those two are separate entities. They're rooted in either trauma-based experiences or in compulsory experiences and obsessional thinking, and have been separated out. Among anxiety disorders, by and large, the ratio still suggests more, or the epidemiology still suggests that more women than men will experience any given one of them. There are some conditions in which the rates are less skewed based on gender, like obsessive compulsive disorder and bipolar disorder, if we start to look at mood disorders. But I think one common one certainly is within the realm of mood disorders is major depression. And I think we're seeing a lot more outreach and speaking out about the experiences of major depression in men. Now, depression will impact about half as many men as women by most accounts. But I think there is also some research to suggest that those data are confounded, that they're confounded by the sheer nature of the experience of depression in men, but also the likelihood of men being identified as having depression or even being willing to share the experience that they have. And so we know about 1 in 8 guys will experience major depression over the course of his lifetime. And rates will go up at particular periods of time. One of those is in the first year post-fatherhood, or post the birth of a kid. And so in the first year postnatally, the rate goes up. And it's
Why do you think that is?
Yeah.
Sorry, you're just getting to it.
Yeah, no, there are a few reasons. I mean, um, there are some risk factors that have been identified. So, first-time fatherhood, younger fatherhood, fathers who have fewer social supports, or are struggling financially. But there are also a number of additional risk factors that seem to come up, and a number of potential contributors. So, for starters, there's changes to sleep patterns, the sheer change
Mm.
of responsibility, but also a number of indicators to suggest that men will experience very similar hormonal changes as moms do. That fathers will also experience um changes to estrogen, testosterone, cortisol, oxytocin, in a way that would expand the possibility of baby bonding, but also place dads at risk for the experience of major depression. And so, uh,
Well, tell me, how do these different chemicals interact to contribute to that? I haven't looked into this very much.
yeah, so this is a really interesting area of research. There's some quite a bit of research actually to suggest a drop in testosterone within the first year of during pregnancy and within the first year postnatally. That there's also a bolstering of cortisol, which is um, a chemical that's often associated with stress responses. That there are changes, sort of fluctuations in estrogen levels, and also increases in oxytocin, and that is a hormone that's associated with bonding and connective experiences. Well, in many ways, these changes are very highly associated with um, an increase in parenting behaviors, with an increase in bonding behaviors. But they've also been shown to be associated with, at least in men, risk for depression, drops in testosterone in particular, changes to cortisol levels. And so, whereas it is valuable for the sake of bonding, it also puts men potentially at risk from a hormonal level, from a physiologic level, for the experience of depression. But probably the most common risk factor, or at least the most commonly cited risk factor for depression in dads, is depression in moms. And so what's interesting is
Mm.
about 10% of men, at least this is what's been reported, about 10% of men will experience major depression within the first year postnatally. Um, if if mom experiences postnatal depression, dad's likelihood goes up from 1 in 10 to somewhere between 1 in 2 and 1 in 4. So somewhere between 25 and 50% of men who are partnered to moms who experience postnatal depression will also experience postnatal depression. And so it sort of speaks to the importance of screening, especially when mom is found to have postnatal depression. The likelihood in the male partner will be substantially higher. And I
Mm.
think, at least, I mean, in many ways, so the two times that I've had the privilege to be able to speak about postnatal depression in fathers outside of the United States have been in Australia, and I think that's had a lot to do with initiatives um, in Australia and New Zealand both, to really push for screening of moms and more recently of fathers as well, and to open this dialogue around postpartum mental health for dads.
Mm.
It's huge. I mean, it's really leading the way in discussion around the world, but it's a painfully absent discussion here in the United States, and I would say also in most of certainly certainly in North America. I
Okay.
think that the UK is sort of just behind Australia and New Zealand in terms of the research and the initiatives that are undertaken, but certainly ahead of the U.S. In doing that. And so It's not common here for men to be screened in the, for fathers to be screened in the postnatal period. I think that screening is probably underdone even for moms as well, but
Mm.
certainly far less frequently for dads.
I don't
Um,
recall when I had my two children ever having been screened for any
yeah,
postpartum depression, if that's the word, postpartum
yeah,
depression. Um,
yeah.
what are the rates for women, generally speaking, who do go through postpartum depression, and for how long does this usually last
Yeah,
for?
so yeah, this is important. It's more common in moms than in dads, uh, certainly. The what's interesting is that in motherhood, there's a fair bit of research that would suggest that it's quite common for moms to experience um, the blues, maternity blues or baby blues. That is upwards of 80% of moms. But that the rates of major depression approach somewhere in the higher teens for moms.
Mm.
Um, for dads, the rates are variable. The research is more limited. It's looking like 10%. That may be an underrepresentation. And I would say the reasons for considering that to be an underrepresentation are many of the reasons that many of us within the realm of men's mental health think that the rates of underreporting and underrepresentation for men in the experience of major depression are also present. Men tend less likely to self report depressive symptoms, tend less likely to even recognize that the mood symptom is a depressive one, tend less likely to use the term depressed or sad. And with such subjective criteria responsible for making the diagnosis, these factors really confound the rates of, or the epidemiology and the rates of prevalence for these conditions, because many men are going to suffer in silence. They're not going to seek help. They may not necessarily name the experience of depression in the same way that the textbook might ask. And on top of it, there is some research to suggest that men's experiences of depression actually look different, that they diverge implicitly from the textbook diagnosis of depression. So by the book, you've got to have at least 2 weeks of low mood, um, anhedonia or limited interest or limited pleasure in otherwise pleasurable activities, and then a slew of additional symptoms like changes to sleep and energy and concentration and appetite, motivation and worthfulness or self-worth, and then suicidal thinking. And that cluster of symptoms sort of has historically been identified as the marker for depression. Well, men will more often tend to experience irritability and anger, restlessness, externalization like turning to substances or gambling or risky sex, uh, numbing behaviors, feeling drained, not being able to cry, not being able to emote, uh, having a very rigid desire to be left alone. And so they're not
Can
factors. Yeah,
I guess just to carry on from that,
yeah.
are there any indications that men would engage in increased mate guarding behaviors? So put, for lack of a better word, clinginess to their partners in these situations, or jealousy type experiences in their partners when they are feeling depressed, or is this not consistent?
That's really interesting. That's something that I would need to look up because I don't know if that's true or not, but I would imagine that the matter of jealousy in particular would emerge. Um, for starters, many men, particularly men who experience depression, will report feeling quite angry. We'll feel angry at, um, we'll feel sort of, that anger may be directed, it may be poorly directed, it may just be anger at large, um, but there is a sense of, in men, in new fathers, an experience of harsh self-criticism and um, feeling diminished,
Mm.
irritability, and anger. And so I could see that translating to a feeling of being undermined, being left behind. Um,
Yeah,
yeah,
I can personally attest to some really, and there was so much cognitive dissonance there with my first child. I was 20 years old when I had
yeah,
my first son, and there was a feeling that came out of me that I can only describe as jealousy towards my son having so much time with my wife at the time, and it was so weird to experience because I'm like, what the hell am I doing being jealous about my son when this is my son, this is my wife, and trying to come to terms and make sense of that was really difficult at the time. And I was in my early 20s. Like, come on, there's so much that's going on in
yeah,
my early
sure.
20s. But yeah, as with my second child, there was no issue. I had my second child at 25, and I had none of that. None of that stuff. So I wonder how much of that was just my own processes that I had to work out and kind of go from there, and how much was, well, I know I've read in the literature there are these experiences of jealousy
For sure.
with new, yeah,
That's common.
regardless of that, yeah.
Absolutely. I don't, I would imagine those rates, I don't know offhand if those rates go up in postnatal depression, but that is a really common experience. These sort of cognitive experiences that riddle the first year of parenthood that don't get discussed feel like they're worthy of discussion because I think they're often held in and sort of seen as shameful.
Mm.
Obsessive thoughts, which I think impact mothers and fathers alike, obsessional thoughts about um, danger or harm to the baby or fears of being responsible for the harm. There are experiences that are held on to with tremendous shame, and I think the same goes for jealousy. Here you see your partner um, clinging on to uh, a newborn, and perhaps you being dismissed in many ways. And we know that in many ways, at least societally, the father kind of gets dismissed from the initial bonding experiences, or at least the sort of engagement within the family and engagement within the medical system. Um, but also, mom's experiencing a very different level of connection with a baby than dad can, at least at the very beginning. And that's tough. And I think these are experiences that are super common. They're not necessarily pathological. They're not often discussed. They're not uh, regular. They're not regular conversations
Mm.
topics.
That's why I
Yeah,
think the work that you do is probably one of the most important things that we could do in terms of men's mental health, because you kind of have these discussions around, well, what are men going through, what are the commonalities, what can you see, what can you, how can you work with these, and that's a real testament to the applicability and utility of discussing these experiences with other, especially other men, I would see.
yeah, I think so. I think there's something about it that it feels really important. For me, it's taken just my own personal experience around this. It's taken many years to feel comfortable with this. I'm a fairly private person who doesn't normally share a lot of my own inner experiences and hasn't throughout much of his life. And so um, I'm just aware to the sheer, and it's still a little uncomfortable for me, but I'm just aware to the sheer value of it, the power of it. I get something out of it tremendously from the standpoint of just being able maybe to give voice to my own experience and to normalize it for other men. Um, the experience of fatherhood is really fascinating one. In part, for me as a non-dad, it allows me to ask a lot more questions and make assumptions about fatherhood based on my own experience. And I think I've had to overcome a tremendous amount of imposter syndrome around working with new dads, because initially my thoughts were, well, what's my role in trying to help a man who's gone through something so important that I haven't? And I may not be able to relate, or they may not be able to find any credibility in me. And I realized too that that's not my role. My role is not necessarily to sort of have the answers. My role is to be available to lend, to create this space in which an ear is lent, but also in which important questions get asked, important insights get made. There's an invitation to connect in a meaningful way and get clear on what's most important to men. And from that standpoint, I work with lots of men who have faced lots of things in their lives that I will never face. And so it makes it no different that I don't share
Pierre,
this experience.
it puts you, Pierre, in I, I think an even better position in some
Thank you, Ron.
ways, because you get to adopt that curiosity and to see, whoa, and then you're kind of asking all these questions that perhaps other fathers would just take for granted, that because it was my experience, I'm not going to ask for this, because of course it's experiencing what I would have experienced, and it's probably an implicit bias that they have. But for yourself, it's kind of like, okay, tell me about this, what about that, oh, that's interesting, I heard that from this other person as well, tell me more about this, and then how do you go with this one? Wow, it's I think it does put people who haven't had these experiences, if they're open enough to do it, rather than to be concerned about, oh, I don't know enough, and so I'm going to come up as kind of like a fraud, or you mentioned it before, an imposter, because I haven't had this experiences before. I get this all the time when I work with people who have an addiction. So have you been addicted to ice before, or have you been addicted to heroin, or have you? I'm like, well, no, but I've helped thousands of people through these sorts of experiences, and it kind of gives me a sense. But I'm like, yeah, but if you're looking for somebody who's been through it, then I can offer what I can offer. But in the end, it's what you feel like is the most important. And I'll tell you what, only a tiny handful of people would need someone explicitly who has gone through what they've gone through. But what I say is, even if someone has gone through, they still have a different story to you. They have different experiences. They have different motivations. But thank you for that sharing, because that's a cool element.
I appreciate that.
I want to continue on a little bit, if we can, around the jealousy element, because jealousy is a big one. I'm doing a bit of reading. I'm not sure if you've done much work or looked into David Buss before, the evolutionary psychologist. So David Buss is an evolutionary psychologist that talks a lot about his expertise is around relationships from an evolutionary psychology point of view. And I don't like the title of the UK and Australian version. It's called Bad Men, the hidden roots of sexual deception, harassment, and assault. But in the States, the title is When Men Behave Badly. So I like that title a lot more than Bad Men. So
that's interesting.
Yeah, the reason I'm bringing this one up is because he talks a lot about and there's been a, an amazing resurgence, or probably an inception into the utility of jealousy as an emotion that is different to the basic emotions that one might have
Hmm.
around anger and happiness, because they're all directed
Sure.
at expressing certain non-verbal cues to invite a particular response within other people. That's what the utility of ordinary primary emotions are, whereas
Yeah,
jealousy is often covert and is
sure.
behavioral rather than you might not be able to tell whether someone's feeling jealous or not, but internally they know. So it's a different type of emotion that is specifically related, in most cases, to mate guarding in men and relationships,
Makes sense.
and that at the same time is related to, or is this person going to leave me, or do I have what I can I offer what other men can offer? And if
Hmm.
men feel down and depressed, this is why the question around depression and tied to jealousy, if someone else is better at providing this for my partner than I am, or than I think I am, is she going to leave me, and do I have to jump and like hold her a lot
Hmm.
tighter? And in my question for you would be,
Hmm.
in terms of working or coaching people through these sorts of experiences of jealousy, where they may even make up things in their mind that their partner is doing that just has no evidential basis at all, and it
Yeah.
drives the partners away. How does one process that? If someone's listening today and saying, hey, yeah, I'm going through that, I'm a super jealous dude, and not that many people would say that, but hey, yeah, this is something I'm struggling with. So how do we work with that? How do you address that?
Yeah. Well, that's a really interesting question. I think I think bringing to light perhaps some of the more covert or underappreciated emotions um, and assumptions too are often at the heart of that, because they're in many cases there are assumptions that are based on either prior experiences or based on self-image, based on self-limiting beliefs, and so I think I would focus my attention on gaining some clarity behind what the experience is, both emotionally, but also what might be behind the experience of jealousy from the standpoint of how a man might see himself as compared to how a man may see his partner, at least to start. But
Mm,
in the context of depression, we do see that sense of extreme self criticism, feelings of worthlessness um, or guilt, even to a point that exceeds what may be rooted in logic.
mm,
And so there are certainly risks for the experience of men feeling like they are so unworthy that they're burdensome, that our partners don't want us,
yeah.
um, that someone else would be better off for them and for the people around them. And so often, I don't often see that in the form of extreme jealousy. I think I see it more in the form of either self diminution or um, or sensitivity to rejection, at least in
Talk
men
about
with depression.
attachment styles then, if you have much of an insight into how that relates to attachment styles.
Yeah.
what kind of experiences or what kind of attachment would a man tend to need to have if he is acting out in jealousy or in anger around their particular uh, their mate, so to speak?
Yeah, it's often the sort of anxious attachment, um, this feeling of uncertainty around the coherence of that degree of attachment. Um, and, you know, if we look at sort of I'm less uh, well read in attachment theories, but I would imagine um, there would be some discrepant styles between a man and his partner,
Mm.
in terms of perhaps an anxious man or an avoidant woman, or an avoidant partner. I
Well,
think
that
it's
would be
more.
that's a recipe for a lot of conflict. If the woman tends to be more avoidant, and there's a lot of
Yeah,
there might be a lot of stonewalling and the anxious, ambivalent type attachment styles, the men are drawing closer because they sense it's a rejection, and then that becomes overburdensome, and it's a recipe for disaster. Unless a
yeah,
person is able to, and there's a lot of good evidence that people are able to to change their attachment styles, um, and yeah, there's a lot of recent evidence of all the
yeah,
way from John Bowlby back in World War
yeah.
II days,
Oof.
to right now, where there's this huge research base in uh, these areas. Because for those of our audience who aren't aware of attachment styles, and these are just the way that we were responded to as children, and that tend to either make us feel comfortable and prepared for and cared for by our caregivers, versus the opposite, where our caregivers may not have responded to our needs, and these can actually influence on, other relationships later on in life. And that can come up in romantic relationships. It's a tough gig, man. It's a tough gig
Yeah,
because we have all these baggage that we carry throughout life, and then if we're a man who wants to keep that in, it's like, well, no, this is just the way that I am, So, well,
yeah,
I'm not going to
yeah,
change. It's like, what?
yeah,
Come on. Let's explore that a bit and see. Well, let's see how that goes. But
yeah. And maybe there's value in reconfiguring. I'd be interested. It is not an area that I've seen. And maybe I've just not seen it, or I've not looked into it. But it'd be very interesting to think about, or to see how attachment styles impact men's experiences of depression in particular.
mm,
Uh, it'd be very interesting, because I think when I think about the experiences that men tend to face when it comes to interpersonal engagement in the face of depression, oof, those styles are very, with at least according to a fair bit of research and I suppose my own experience too, those styles are very withdrawn and sort of avoidant. There's not much of an emphasis on connecting. And I think much of that has to do with the stigma that's associated with depression for men. That the response to this vulnerable experience is to withdraw.
mm,
But there is such there is such a big element of withdrawal for people of all genders, um, in depression, to sort of um, to isolate. But it's really prominent in men, that men have a greater tendency to experience attacks of anger, lashing out at other people, particularly their partners, have very rigid rules around maintaining their own sense of autonomy, withdrawing, turning to numbing behaviors that will often isolate even more. It'd be fascinating to think about how, if there's an interplay with attachment styles and how
Mm.
depression might show up differently in men. Yeah,
Yeah,
it's fascinating.
certainly. I'm sure
I know you're onto something.
we'll both be looking at this sort of
Yeah,
stuff after this interview
yeah, we
ends.
will. I'll let you know if I find anything.
Yeah, well, Pierre, tell me a little bit about your own. You mentioned this a few times in our interview today about your own personal experiences that have led you
Yeah,
to develop into the way that you are and choose the work that you do. Would you mind telling our audience a little bit about yourself and how some of the things that you've experienced have shaped you into who you are and the work that you do?
sure, absolutely. So I would say through much of my life, I I grew up in the States. I grew up in Texas, and my parents are Middle Eastern, both refugees, very hardworking. Uh, I think worked very hard to create a very different life for their kids than they had themselves. And I think for me, there was a really big emphasis. And I think a big part of this was very self-imposed, but a very big emphasis on achieving and seeking accomplishment, um, and seeing the value of accomplishment as almost a source of pride for my family, as a source of opportunity, frankly, for my family. And so I think I grew up in a way as to equate achievement, personal achievement, perhaps also stoicism and working through challenging situations as a tremendous source of pride. And so I spent most of my childhood, adolescence, early adulthood striving to accomplish. And that was mostly in the academic realm. And so um, I did fairly well for myself when I went to university and then medical school and felt very committed to continuing this life of working very hard, pushing through challenging situations, tamping down any of my own personal challenges, and pouring my all into schoolwork and then eventually into my craft, into my profession. And I think in many ways that became a bit of a recipe for a big fall. And for me, that fall came in the second year of my medical school experience uh, when now looking back, was probably my first major depressive episode. And by then I had already been trained to recognize depression in other people, but I really struggled to recognize it in myself. Um, it took about 18 months of the experience of major depression before I finally sought help. And in retrospect, I suppose 18 months doesn't feel like a long time, but I say that now and I think that was a tremendous amount of time. There were lots of repercussions associated interpersonally with the experience of depression. I saw it as such a personal weakness. It was an affront to my own sense of self-worth, certainly to my own sense of masculinity. And I sought help, but almost begrudgingly, when I had no other choice. And meanwhile, I didn't anticipate going into psychiatry when I started medical school, but I opted to in part because I loved the work itself, but also I saw the impact personally of suffering covertly with a really common mental health condition. And thankfully have sought help. Now, looking back, OCD has also been a really challenging experience throughout my life. It's something that I have seen even from early childhood. I've written about a few times about the experience of, having recurrent intrusive obsessional thoughts around illness or around danger, even at from age 5. And thankfully, I understandably and expectedly, these are experiences that have impacted my life fairly tremendously over the last 20 years. So my first depressive episode was first diagnosed 20 years ago, and I've since had recurrence, as is common, and I think as most men can expect when they've had at least 2 episodes. And I think more and more what I've started to become interested in is, and find value in, is lessening the shame that's involved in these experiences for men. And I think that really came about from my own experiences of shame and years of trying to make sense of these experiences and finally increasingly coming to terms with them and perhaps using them to help other men to feel less alone. Just aware of how incredibly lonely it has felt in the lowest periods of depression and in episodes of OCD, sort of recurrences of OCD. And what's been interesting for me is just revisiting the values that feel most important to me. So historically, that's been achievement, do the best job that I can do. And I found myself doing that for many years and found somehow that wasn't enough. It was lacking something important. And I think for me that was, and has always been, bringing value one-on-one, being connected, helping men on a more human level than perhaps the work that I had been doing historically, which was very academic, it was very by the book. I was working in the general hospital in leadership positions and loved it, very much loved the work that I was doing, but felt a very strong calling to help men to make sense of mental health conditions in a way that didn't feel so emasculating, that didn't feel so unapproachable or shameful. And that's really when I made the jump to start Braver Man. And that took a lot, I think, for me from just overcoming fear kind of a standpoint.
Yeah.
I've never done anything like this in my life. I've always sort of been by the book, held jobs and careers that were very well defined, that other people defined, never my own thing, never based on my heart and what felt and feels most valuable. And that's a big shift for me. And it's one that's been associated, at least at the beginning, with a tremendous amount of fear. But it's immensely rewarding, and one that I feel really proud to be able to do every day.
And looking back at your own experiences and the shift that you had from psychiatry to being able to support people through coaching and through your own experiences with depression and obsessive compulsive disorder, do you actually, in regards to the latter, do you notice that, or do you think you have something a little bit more to offer to someone having had this background in psychiatry and paired with your own mental health struggles that you've had before, and now going into the coaching realm versus if you hadn't had those experiences?
Oh yeah. Yeah, most certainly. I mean, it's funny because I suppose I could have landed on this sort of end point without having gone through my medical training or psychiatric training. Though it's something that I left with a tremendous, I left with a love for it. I felt compelled and called even really to work with men in this coaching realm. But my work is very informed by my work as a psychiatrist. I think at my heart um, I will always be tuned in and have a finger on the pulse of what's happening in the space of mental health um, because so many of the men with whom I work have faced depression or anxiety or other
Mm,
conditions, eating disorders or body image disorders. Um, and while the work that we do may not be necessarily uh, primarily therapeutic in that regard, there is a lot to be said for coming to terms with the experiences of mental illness and mental health in the narrative of our lives, that perhaps we can
mm,
utilize those experiences for good. And in many ways, I also feel kind of compelled to do the same, that I've grown to really find a tremendous degree of gratitude in the experiences that I've faced. And as troublesome as they have been historically, they're not ones that I would take back. They're ones that feel like they've informed a big part of who I am. But certainly, I am at heart someone who's always going to be inviting men to gain awareness to their cognitions and their emotions and their behaviors, our
yeah.
behaviors.
That's a hugely complementary approach when you're able to integrate these different elements of where you've been, where your training is, and how other people present to you, and gear it. My idea of coaching these is generally a present and future based focus, whereas therapy is kind of working on what's happened before and how do we process
Yeah,
that. Is that your experience, sir?
yeah,
Yeah.
very much so, very much so. And
Mm.
that's generally how I frame the engagement. That there's less of a focus on the past, although often the present and future are highly informed by the past. There's less of a focus
Mm.
on getting to the why, I suppose, and there's more of an emphasis on channeling the strengths and working through the
Mm.
limitations to move you forward into creating a vision for how the
Yeah.
future looks. Yeah,
Yeah, I call it the knowing the why behind the what. So
I like
that's
that.
that's a it's a good way of framing it. It's funny because when I'm doing therapy, when I'm delivering therapy, I
Yeah,
come up with all these little quips that
yeah, I love that.
I most of the time just forget after I've said them, and I don't pre-think them, but they kind of come off through conversations, and then maybe years later or months later, people say, "Oh, I remember that thing you said." I'm like, "Oh, did I say that thing? Are you sure?"
Yeah,
It's an interesting
beautiful.
it's an interesting one.
I love
But
that.
before we do end today, I want to ask you
Yeah.
if you could say something that you might have missed, or I haven't asked you about, anything that you think our audience should know about yourself or men in general, and what would that thing be?
Yeah. Um, you know, I oh, I appreciate this opportunity. I
Mm,
think, especially in this like very connective way, just getting to know you a little better over the last hour and almost 2 hours now. Uh, it's, I think I think what I would invite here is an invitation for men to reach out to their friends, to reach out to their mates, to invite a deeper connection. I think as far as my work goes, the piece that has always felt the most important is perhaps the piece that feels most lacking for men, which is deeper, truer, more authentic connection in a safe way. In a way that also respects boundaries, in a way that respects the challenge of vulnerability, in a way that invites vulnerability without shaming men. And so my sense and my experiences in working with men that that loneliness is endemic, that is such a common experience for men, this feeling of isolation, I think especially over the last couple of years. And there's a sense too that I'm experiencing what I'm experiencing in terms of vulnerability on my own. Other men may not be able to relate. I'm going to be seen as less of a man or as less strong if I were to open up more fully or share this experience with another man. My invite to men is really to reach out to their friends, to reach out to other men, to invite these conversations. They don't have to be super deep. They don't have to feel scary. And they can still be in the context of the ways in which we men tend to relate to one another best, which tends to be over common action, shared mission, shared purpose, shared activity, but might just go beyond the superficial into some deeper aspects of life. My sense is that most men want that. Most men actually do want connection. That most men don't have that. And this is sort of an invitation to invite that in the men in your life.
You raise a good point, Pierre. It's often when men get together, they appreciate deeper discussions, even if those discussions are philosophical or occupation based. Men tend to appreciate the deeper delving than compared to these superficial what happened in the past week or what's going on right now. What did you do this day? It's kind of like, let's get a little bit deeper. If we can frame that discussion in a deeper way in terms of personal experience, and it could be just a molding between the two, where you see nuances between experiences and say, I went to work today and this guy pissed me off or what have you. It's like, oh, wow. Yeah. How do you know he, like, well, what was going on for you when that happens? It's like, oh, well, I don't know, I was bloody angry or something. It's like, okay. These sorts of things, but kind of going a little bit deeper. It's like, I know. Well, when I get angry, I feel like I need to, X, Y, and Z. And anger is an appropriate emotion. Jealousy often is an appropriate emotion for men, appropriate in inverted commas. So they're more likely to describe these sorts of experiences and kind of delving into them a little bit deeper. That could be an inroad in that. So I appreciate you bringing that one to light. And if our audience wanted to find out more about you, Pierre, where could they look and how could they get in touch if they wanted to utilize your services and the work that you do?
Sure. Perhaps the quickest way is through Instagram. The handle is @braver.man, or my email, which is Pierre, Pierre, @bravermancoaching.com.
Beautiful. Thank you. You heard it, guys. It's been a pleasure to have you on the podcast today, Pierre. Without further ado, I'm going to just thank you. Thank you for appearing and bearing yourself.
Thank you, Emil. The pleasure is mine.
So there you have it, my interview with Pierre Azzam, former psychiatrist and current mental health coach, and that works primarily with men. I think it's an amazing conversation that we had, all very, very questioning. What I noticed is earlier, before the interview started, he mentioned if it's okay to ask me some questions, but I noticed that he didn't have time because I kept probing, and it was funny. After the interview finished, we had a bit of a giggle around that, and it was a really fun and a really dynamic conversation that if you do have any questions, send them through to him, send them through to me if you need to, and I'll be that medium between you and him if you need that to be, but you can find him easily online on Instagram. If you haven't already done so, please subscribe to the YouTube channel, follow me on Instagram, on Facebook, on Twitter. These things really do help the channel out, and you can find all the details on the bio. One other thing that Pierre commented on was my kids' book here. We've got, it's not kind of looking, we've got Caspian and the Zombified Gastropods. For those who are listening, I've just finished writing a book for my kids about Caspian and Michael, who come to school one day and their teacher has a really interesting specimen, which is a zombified gastropod, which is pretty much a snail that gets infected with a parasite. True story, this sort of stuff. And the parasite takes over the faculties of the snail and pretty much controls them. So this story that I aim to have published one day is their experiences on navigating an apocalypse, a sort of zombified gastropod apocalypse that takes over and infects the students in their school. How does Caspian save his brother? How does his brother, or do they get out alive at the end? These are the interesting questions that come up in this particular book. But for those who are more and more interested in exploring these types of themes that we covered today in today's interview, get on board, drop me a line. I read every comment that comes on YouTube, that comes onto the socials. I'll respond to you directly and share it around. If you found it helpful, please do share it around. Until next time, thank you for watching, listening, and just engaging with our conversation.